Welcome to Attributions. Today we're speaking with Hannah Mason about all things heatwaves and public health at sporting events. Hannah is a lecturer and researcher at the College of Public Health, Medical and Veterinary Sciences at James Cook University. She's worked on a range of public health and safety research projects, including exploring the impact of heatwaves on health systems. Today we talk about a lot of things that included heatwaves and their impacts on public health systems, extreme heat and sporting events, the impact of extreme heat on athletes and spectators, the Paris Olympics and what the organising committee is doing to reduce the effects of extreme heat and if it's enough, and many other topics. It was great to get Hannah on the show, and I hope you enjoy the conversation as much as I did. All right, so we are here with Hannah Mason. Hannah, thank you so much for coming on Attributions. It's great to get you on here.
Thanks for having me today.
Now, Hannah, I wanted to talk about all things to do with extreme heat or heat waves and public health, and then, of course, go into talking about the upcoming Paris Olympics coming up in the European summer later in the year. But first, I'm wondering if you can just tell us a little bit about yourself, like your career history and what you're working on, and of course, what your research focuses on.
Sure, yeah. So I'm Hannah. I've come to Australia from Canada originally. So in a land where most people might think no heat waves exist, but they certainly do. But I came over to Australia to James Cook University up in far north Queensland in Townsville. And I did my Master's of Public Health here. And then graduated in 2019. And as I was about to make my trek back across the pond to Canada, COVID started and the world was ending, and I ended up staying in Australia. And while I was here, I got to work with Professor Richard Franklin, and he was investigating the impact of heat waves on health service delivery here in Queensland. So that includes ambulance and hospitals and deaths and emergency department admissions. So he said, "Oh, do you want to hop along and learn a little bit about research?" And I said, "Yeah, sure." And what started with a 1-year project has blown out to a 5-year project. We've got so much interest and we found so much interesting information. And that, got me hooked into this space. So that's kind of what led me to here. And now I'm up here in Townsville lecturing and also continuing this research.
Well, I think for anybody's information, Queensland's, the climate in Queensland can range from, tropical to subtropical. So it does vary quite a lot. And up where you are, for people's information, it's, I would say, gets pretty much hot all year round, right?
That's right. For a Canadian, certainly hot all year round. When I arrived here, it was January, which in the Southern Hemisphere, of course, is summertime. And I came from Northern Hemisphere wintertime. So I think it was about minus 26 when I left Canada. And when I arrived and touched down in Townsville, it was 32. So it's
nice
very,
jump
very
there.
warm up here. But in Queensland specifically, we have quite a few different climate zones. So you're right, the climate does vary across the state. And that's something that's really unique to Queensland.
Yeah. So I think a good place to open the conversation now would be to talk about, I guess, what your view on the current situation revolving around extreme heat and public health in the context of how this has changed over time. So if we compare, if we look back on the past and look at extreme heat's impact on public health and then compare it to more contemporary times, how would you say that it has changed?
Well, I think, anyone who watches the news feels like they're hearing about extreme heat more and more frequently. It's almost every year you see some sort of headline that says that it's been another record-breaking year for extreme heat. Last year, 2023, was the hottest year on record, and we're on track for 2024 to beat that record. And I think, the last 10 years have been the top 10 hottest years. So or something to along that effect. So we're seeing and feeling these increases. Even if you just look at, your Twitter feed or your LinkedIn or your Facebook, you can see more posts about heat and how people are dealing with the heat. So it's certainly, climate change is being felt. Whether people like to embrace that it's climate change or just embrace the fact that they are sweltering hot on a hot day. it's being felt. And it's not just, by us individuals, but it's also by our health systems. It's also, by the people who are paying for those health systems, our taxes in most countries. I think that the proof is now in the pudding. We can see that this is happening. We can feel that this is happening. And the trajectory is looking very scary.
How, in your estimation from like your research, for example, what has been, I guess, the major impact on public health systems when an extreme event like a heat wave or a prolonged period of extreme heat, kind of hits the country's health system?
Sure. So from our estimations, our research again was in Queensland, in this state in Australia. And what we found is an interesting kind of effect. So the greatest effect was seen for ambulance calls. So if you think about how you might progress through the health system, first maybe call to 911, someone's collapsed, they're not feeling well because of the heat. That was followed by the next biggest impact was on actual ambulance attendances. So actually when the ambulance is called out and when they arrive on scene. And then from there, a little bit more of a decrease, but then the next biggest hit is the emergency department. And then after that, we see hospital admissions, and then we see deaths, which is, of course, the most extreme outcome of a heat wave. But in Queensland, we're still seeing increases of about 5%, which, maybe doesn't seem like that much. But when we think about it, a heat wave causing death is a really extreme impact. And we're seeing ambulance calls increase by about 13% here in Queensland. So if you think about, even just your staffing, if you have, if you need 13% more staff in a heat wave period, or you're getting 13% more calls, in most regions of the world, and Australia certainly is no stranger to this, our health systems are already very overwhelmed. There's a lot that's going on in our health systems, an aging population, increasing chronic disease, all of these kind of things. And then if you add an extra layer of the impacts of climate change, and heat waves don't always happen in silos. So you think about here in Townsville is a good example. We have a really bad flood and people are outside and they're trying to, figure out what's going on, collect their belongings, save their houses. And then that's coupled with extreme heat. So your exposure's increased, you've just gone through this flood, and now you're going through a heat wave. So we kind of have these cascading events, also a lot around bushfires, right? Because then your air quality. So, the effects are so large, and quantifying them is quite a job in itself, because you can kind of see how it gets its fingers into everything.
And I think it's also concerning. One thing that you raised just before is aging populations too. And, I know most developed countries in the world are going through a period of significant aging, and that's even trickling down into some developing countries as well, and in particular in Asia, for example, like your South Koreas and your Japans.
That's
and
right.
When you put that together with, an extreme event, generally speaking, the most vulnerable population are the elderly people that don't have access to, for example, proper cooling systems and things like that. And then, you've got those kind of horror stories where you don't hear about the person actually dying. They just die in their
That's
small
right.
apartment, for example. It's pretty worrisome.
It is. And you know what? With increased age usually comes more health comorbidities. So you know that in those, when your body is overloaded and overstressed and overheated, then those conditions themselves can be exacerbated. And then we kind of come into this mess of, body is already trying to regulate itself, but then we have this stress of extreme heat, and that can lead to, in most extreme cases, death.
So what about the economics of all this? Like, how much is, for example, a heat wave or a prolonged period of heat impacting, the economy in terms, if you look through it for a public health lens? For example, we regularly see things like, extreme heat is causing impacts on the economy because, for example, I don't know, construction workers can't, build whatever they're building. But we don't necessarily hear much on the topic of how much this is costing the health system in general.
So some research in the States has estimated that since the 90s, heat waves have cost globally around $16 trillion. So, I mean, that's hard to even think about $1 trillion. Here in Australia, it's forecasted that by 2030, it will cost Australia about $19 billion per year because of the rising temperatures. So it's certainly a big number. And it's not just the reactivity when the heat arrives, and, okay, we have to call off work or we have to call off this sporting event or something like that. But it's also everything that we have to do to mitigate and plan beforehand. So we're thinking about things like the Brisbane 2032 Olympics, and we're thinking about what are all of the things that we need to do to protect people from heat so that we can enjoy the games and have a safe games for people to come and attend to and that we're proud of. And that takes a lot of resources and a lot of thinking and paying people with these brilliant minds to talk about it and then actually developing that infrastructure. So it's a very large cost.
This is a good segue into actually what I wanted to talk about in terms of heat waves and their impact on sporting events. And I mean, you for example, you mentioned Brisbane in the Olympics in Brisbane in Australia in 2032, I think it is.
That's right, yeah.
Yeah, so it's obvious that heat waves are going to magnify, some of these impacts on these mass gathering events. I'm just wondering, lately, has there been any kind of warning signs that, that you've kind of seen that might occur, on a bigger scale, for example, in the future?
Heaps, yes, definitely. And it's something that, Olympic organizing committees are concerned about and are thinking about. For example, the Paris Olympics are about to start in a few weeks, which is very exciting. France in the summertime has potential for extreme heat, and we've seen extreme heat events occur in France with a really high human impact regarding death and also other health issues that come from that. So yes, it's certainly something that we have to think about and that we are thinking about. It's really interesting, though, how we want to manage it, because what they're trying to do in Paris is try to reduce the emissions of the games, right? And here in Australia and in a lot of nations, what happens when it gets hot? We flick on the air conditioning. That's how we cope. And what does that do? It further increases carbon emissions. So we just kind of get in this vicious cycle of we put power on the grid and the grid's already, you're putting pressure on the grid. The grid's already struggling because of the heat. And then what happens if we have a blackout and we can no longer cool ourselves, right? So in Paris, what they're working on is a geothermal cooling system in the athlete village instead of using air conditioning. Because in Paris, Paris is an old city. There's not a whole lot of units that have air conditioning. So this is really interesting that they're taking this approach, and they've tested it against heat wave conditions, which is really great. But a lot of nations, including Australia, aren't really backing the initiative. So Australia has spent hundreds of thousands of dollars on portable air conditioning units for athletes, right? And then, so they're going to go home. They're hot because they've been exercising all day. And then they flick on the aircon, which is essentially diminishing all of the work. But if you're from a poorer nation, that can't afford that, then where is the equity in that as well, and protecting your health and staying cool? You're told to shut your blinds, right? So it's really interesting how it's being managed, how it's being thought of, and we kind of have to marry this, how do we protect ourselves whilst also not making it worse for ourselves in the future, which is challenging.
Do you think that for example, that you mentioned that the Olympic Organising Committee in Paris, they're using this kind of geothermal cooling system. Do you think that kind of stuff is enough? They're also talking about insulation and double glazing windows, for example. But I'm just wondering, in a situation where you do have crazy heat, is that stuff going to be enough, or will we unfortunately be, having to default back to an AC unit?
It's a good question. And, they have said that they've tested it in heat wave conditions and that it will be enough. But really, we won't know until this is the first time it's going to be used. So we won't really know until we see, firstly, if we do have extreme heat during the games. And then secondly, what's the fallout of that. But it's an important issue, this nighttime temperature, because not only is it getting hotter in Europe during the day, it's also not cooling off as much at nighttime. So since the last Olympics in France, which I think, in the 40s, I think, the nighttime temperature has also increased by, I think, over 3 degrees. So, you're hot in the day, but then you also can't cool down at nighttime. And that's the time for sleep and rest and recovery and for your body to kind of do a reset. And if you have a bad sleep because you're hot, and we've all been there on a hot night when you can't sleep, it's the worst. And then you've got to go compete at an elite level of sport the next day. You see what I mean? It's just these compounding things. So it's a good question. I don't know if it's going to work. I hope it works, because then that's a great outcome for both, future games and for the athletes that are there. But we're not sure yet.
Yeah, no, I think the intention and the premise that they're doing that on is really good, and I fully support that kind of stuff. Like, natural insulation is great, and any sort of situation where you don't have to necessarily use the air conditioner is a generally a good thing. I kind of worry, because there are some cases where it just gets to the point where, for example, it gets so hot that the human body can't even, it stops regulating your heat, and it can't even control the heat, and then that's when fatalities start building up. I mean, it reminds me of especially in, like an old city like Paris, where the infrastructure in general and the housing is not built for those kind of conditions, and that's why you get situations like, I remember, it was a long time ago now, almost over a decade, but they had there's a mass loss of human life there. I can't quite recall. Do you know the event that I'm talking about?
Yes, I do.
Like, hundreds of thousands of people died.
Early 2000,
That's the one.
And it was about 14,000, I think, deaths, which is incredibly tragic. And you know what? It's not just the athletes, and I think this is what we've been looking into. Okay, we have all this cool stuff for athletes. We've got these pills that you swallow, and you see what your internal temperature is as you go ride a bike in a sauna, right? There's all of these things that they do. And when you look into the research around sport and heat, there's so much physiological stuff, really innovative, cool tech. But then what about all of the mass amounts of people who are just coming to watch the games? And they're coming from all over the world. So we've been talking, of course, because I'm based in Australia, we're thinking about these Brisbane games, right? And okay, well, they're occurring in the winter, so we don't have to worry about that. In Cairns, which is the northernmost point of the games, the closest to the equator in Australia, you can have a winter temperature when the games are occurring of 28 degrees Celsius. If you're from where I'm from in Canada, I'm from Edmonton, Alberta. 28 is a hot day in the summertime for me. I am out on the beach on that temperature, right? So that still has the potential to really impact people, especially when you're sitting in a crowd, potentially not under shade for a long time. And that's coupled with things like having a beer to watch the match and, maybe just losing track of time because this is exciting. It's maybe the first time you've gone to an Olympic match and you're invested, and, certainly not going to say, oh, actually, I'm just going to sit this game out because I'm a little bit too hot, unless you're starting to really feel the impacts of the heat. When at that point, it's almost too late, right? Once the body's actually saying, I'm overheated, you've already kind of gone past the line. You already need to, have that water in your system. So, it's certainly is something that we have to think about on so many different levels, not just the athletes and how they're going to cope, but where are the spectators staying? And we just said there's not much air conditioning and it's an old city. Where are they going? Where are they having lunch? How are they commuting to these events? And how long do they have to wait in a line to get there and potentially stand in the sun? So it's almost an endurance sport in itself, just going to the games.
Yeah, what you mentioned about when the when your body when you get to that certain point where it's too late, it actually reminds me of I don't know if you know the author Jeff Goodall. He's a journalist. He wrote a book last year, The Heat Will Kill You First. And he basically talks about how at certain points your body you don't even realize that it's happening, and then next minute you're on the ground and you're pretty much going under heat stroke and then potentially dying. So, I can kind of, obviously I don't want to think about it, but I can kind of see something like that happening, especially when you've got a big crowd of people. You've got that magnifying effect from all these bodies being in one spot, plus you've got the sun, depending on the humidity, of course, and all those factors that come into play. So I'm actually wondering what kind of mitigation or kind of management solutions, in your opinion, would help, not just the athletes, but also, like the spectators, for example. You mentioned they'll have to line up, potentially in the sun. They'll have to sit in the sun, all these things. What are some of the things that you guys have been thinking about that could help?
Mm-hmm. Well, it's actually interesting because part of our review was we took every piece of literature we could find about extreme heat and mass gathering sport events, and we took out every single recommendation you could find. If the authors mentioned anything that was a mitigation strategy, we pulled it out just to see what they had to say and kind of who was the recommendation targeted at. Because if you're asking, well, what can I do as a person who's going to the event? Stay hydrated, reduce the consumption of alcohol, wear loose clothing, be aware of where you're sitting. Are you sitting directly in sun? Be aware of where the nearest water fountain is, if there is a water fountain. Sometimes I'm sure most of your listeners have gone to a game where you try to go buy a water bottle and it's $10. And you're thinking, oh my goodness, I'm probably not going to spend $10. But thinking about those kind of things, right, at an individual level. But then we have to think about, okay, if we're talking about athletes, some sports have a lot more money than other sports invested, and that's just the truth about the sporting world. So, sometimes it's in the athletes' hands themselves to make their own decision-making, which is really tricky because for some of these athletes, this is their livelihood. This is their ability to pay rent. This is what they've trained for their whole life. So if it's up to them to make the decision, that's a challenging decision. If it's a team sport, then, we've got to think about the coaches. We have to think about the rules, about scheduling and breaks. At the Tokyo Olympics, the last Summer Olympic Games, tennis player Medvedev basically said to the umpire, he was taking a lot of breaks, and the umpire said, are you ready to go? And his response was, well, yeah, but if I die, are you going to take that responsibility on your shoulders? Which is a great point, right? Whose responsibility is it? Because there's mitigation strategies that has to be on officials to call it, that goes up to the actual, Olympic committee, that goes up to the city itself or the state that's backing and funding this to make sure that the train stations have shade and they have cooling. And, so there's just so many layers to what is a mitigation strategy and who is responsible. And the answer is that we're all responsible. We all have to think about it. I want the state government to think about it before they put in their bid for the Olympics. I would like the, Olympic committees and organizations to be thinking about how are they going to protect the players that I'm watching and make sure that they're going to be okay. I want to make sure my grandma who's going to join me and go see the game, she knows what her individual risks are. You know what I mean? It's a community, and it's also an organizational responsibility to make sure that we're mitigating the impacts. And it might come at the cost of, changing when games happen. It might be really early. It might be a different season. We call it the Summer Olympics. Maybe the Summer Olympics don't happen in the dead of, the European and North American summer anymore. That might be something that we have to think about in the future because, we're even hearing instances of athletes migrating because they can no longer train for their sport in their climate. There's a female triathlete from India. She actually relocated to the UK because if it was past 8 a.m., it was too hot for her to try to train, right? And at the point of decision making, we're talking about mitigation strategies like, okay, it's nice to say like, oh, stay out of the heat. But if this athlete has prepared their whole life to train at this event, they're not going to take it easy in their prep. They're not going to say, I'm not participating in this game. My whole family, my whole country is backing me. I'm not going to say it's too hot. So then it has to happen way, way in advance so that we have strategies to protect them and say, okay, we're moving this or we're changing this so that it doesn't come down to an individual decision.
Yeah, no, and of course, when you mentioned the triathlon from India, it reminded me that even some sports are actually much more, they get a lot more exposure to the elements. For example, like marathons, number one, tennis is another one, like you mentioned, the Tokyo Olympics example there. I think that a lot of that track and field work it might have to look at making things early or in different seasons.
Yeah, I was even reading today, which it's so funny because some things you think, okay, like let's say shot put or discus or something. It's like a very explosive, quick sport, and then it's over. But you also have to consider where those sports are taking place, which is on a hot tarmac, where the solar radiation is great. And you're also not just there for your event, you're also prepping for the event all day and sitting there waiting for the event to happen. So, the marathon is certainly one that we're concerned about, but I was even reading today about marathon swimming. And in my head, I think, okay, well, you're in a pool, right? You're cool. But they were talking about, certain qualifying matches that happened when the water was 30 degrees. Right. And so it's not something that we think, oh, that sport's fine. So yeah, there's so many levels, and that's not even considering Paralympic sports. We think about sports that have different equipment, right? Athletes that are in wheelchairs, and how do they regulate their heat, which is completely different from a completely able-bodied person. So, and this is why I really stress this. It's everyone's responsibility because there's so many things to think about. Is the athlete going to think about their risk because they're in the chair, and then also the fact that they want to win a gold medal, and then also the fact of what time is my game, and there's so much that goes behind it.
There's a lot of competing factors too. They're kind of like pulling on each other and pushing on each other as well. So it makes the situation quite difficult to make a really sound choice, because it's I guess it comes down to how much risk is acceptable, and how much can mitigation solutions kind of reduce that risk and things like that.
And there are countries who have been hit by extreme heat and have had mass casualty incidents, and they can kind of learn and adapt and get some new policy. And we've seen that's helped. In a lot of places where they're hit once, they change policy, and then it improves if heat event comes later. But for countries where that maybe hasn't happened yet, or they haven't had that really big one yet, they're also more vulnerable because, they don't have those same things in place. In Townsville, it floods, and we just had a big flood. So now all of our prevention strategies and mitigation around floods are strengthened because it's on top of mind. But because of climate change, we're seeing different patterns in heat waves, and in some regions where they're not used to having extreme heat and maybe aren't as prepared for when it strikes. So that's something that's also kind of changing, and we all need to be thinking about.
Well, Hannah, I realize we're coming up to the the hard stop on your time. So I just want to thank you again for coming on and sharing your thoughts and all these stories. It's a very important topic. It's very topical as well, and I think sports is, it's a big part of a lot of people's lives, and it's a big part of the kind of, I think it's a fantastic opportunity when the globe comes together, and expresses solidarity and things like that. So it'd be a shame for it to change drastically, and I hope it doesn't have to. But before we sign off, is there anywhere that you would like to point listeners to, for example, to your research or to any social media accounts, for example, if you've got anywhere that you want to let people know about?
Sure. I'm on Twitter. I'm Public Health Han, H-A-N. You can also find me on LinkedIn, Hannah Mason, and I'm with James Cook University, so you should be able to find me on there. And yeah, thanks so much for having me. I agree. It's just such an important topic, and it'll be something that's interested, especially with Paris coming so quickly, for us to see kind of how it all unfolds.
Well, fingers crossed we have a risk-free games.
That's right. Yeah, a safe games where we can all come together. As you said, the Olympics are so great, right? It's so fun. And hopefully everybody can just be safe and do what they love to do.
Awesome, Hannah. Well, until next time, thank you so much. If you found this episode of Attributions valuable, please don't forget to subscribe to our podcast channel, follow us on social media, share it with your friends and with your network, and visit our website at www.climateimpactstracker.com for articles and more. Thanks again for listening, and I'll see you again on the next episode of Attributions.